Hi, my name is Dr. Eric Singhi. I'm a thoracic medical oncologist at the University of Texas MD Anderson Cancer Center. We are coming to you live from San Diego at the World Conference on Lung Cancer, and I'm joined by my fantastic colleague, Dr. Bruna Pellini, if you want to introduce yourself.
Absolutely. I'm Bruna Pellini. I'm a thoracic medical oncologist at Moffitt Cancer Center in Tampa. So happy to be here with you.
Always great to dissect data with you. So we had 2 presidential symposiums here at the World Conference on Lung Cancer. Let's talk about the day one, what we heard. And we heard a very exciting study about ivonescimab. Maybe you could tell us a little bit about the drug and your initial thoughts.
Yes, absolutely. So they compare it to pembrolizumab that for 8 years now hadn't been beaten by any drug.
Right.
And clearly we can see a benefit across all subgroups, histological subtypes of lung cancer, different PD-L1, and there's an improvement in PFS, right?
Yeah. We definitely saw that clinically meaningful benefit for patients. Again, this was only restricted to China. So,
Exactly.
Dr. Pellini, what do you think? When we take that information back, is it practice changing yet? Or is it inspiring? Where is this going?
So we do have some regulatory barriers. So this study will have to be replicated in the US. And I think all of us are very excited to open in our sites after seeing that data. And I want to see how it's going to perform in our patients here in the US. I would expect it would perform the same, right?
Yeah, I feel the same way too. I think, one thing that was raised as a concern was that patients that were PD-L1 positive, 1%, up to even higher percentages were included in the study. What do you make of that information and how should we interpret it?
So I know that we give chemo IO usually for that patient population that has a PD-L1 of 1 to 49%. But don't you think there's a value for some patients that are frail or patients that say, I don't want to get chemotherapy? Now we may have an option for them that seems to be very promising.
Yeah,
What do you think?
I think that's a very good point, right? Now we have some data, we have some inspiring data even to suggest that, yes, this drug could actually fill that void.
And what do you think about the side effects?
Yes, that's a great point. So I know that 30% of patients, as opposed to 15% of patients on pembrolizumab actually ended up having some side effects that were grade 3 or higher, but they were pretty manageable, right?
Yes.
We had proteinuria, we had hypertension, but these are things that we're able to manage, help our patients manage. So honestly, I felt like it was reassuring. What about you?
Yes, I agree with you. And one of the things that I find super interesting is that the VEGFs that we have on the market, their half-life is much longer,
Yes.
which makes the side effects harder to manage when they happen. But this drug has a much shorter half-life.
Right.
So that's probably why we're not going to see a lot of issues. So that was very good from a pharmacodynamics and kinetics standpoint.
Yeah. So overall, I think it sounds like we are both very excited about where this drug is going, how it's going to fit into the treatment landscape. And it was really nice to be here live in San Diego to hear the data, digest it, and discuss it with you. So thank you.
Thank you.